Doctors of Reddit, what are the dead giveaway signs that someone is faking? Most often their story/description/exam doesn't make any sense. There are usually things that contradict each other. Abdominal pain is generally easy to tell when people are faking it. For example, I will press with my stethoscope instead of just listening. They don't respond to that pressure, but will when I use my hands instead. Sometimes I'll ask them if they are experiencing a symptom that will rule out a diagnosis or make it less likely, and many times they think I'm asking it to support their supposed issue, so they will say they have it. Most of the time people aren't faking, but just blow their symptoms out of proportion. When I was doing my EMT clinicals, I was 17, still in high school. We had a guy who called 911 reporting crippling back pain. It was immediately obvious when we got there that he was faking a back injury. We did an evaluation and gave him some OTC painkillers, but he asked to be carried to the hospital. The whole way there he begged for something stronger to ease his pain. After a while, the medic said, "Okay sir, unfortunately we don't carry morphine on the bus, but I'll give you an alternative that we use sometimes. It's called normal saline." He hooked up an IV, and within a few minutes the guy was totally fine, telling the medic that it was good stuff and he was feeling much better. Later, I went back and asked the medic what he had given the patient. I had never heard of it before. He laughed and said, "Good old normal saline. Normal saline." Not a doc or nurse, but as a patient it's really messed up when they think you are faking. I had an extremely bad year last year and was almost daily losing consciousness. Couldn't keep food or some days water down. I collapsed one day after having horrible stomach pains. The ER doc doing his job very quickly assessed me and had them give me Dilaudid, thinking I was probably going to be rushed into surgery for gallbladder removal. At the time this was understandable. However, this particular medicine made me become completely unconscious. They were then not able to do my intake or ask me additional questions. The next doctor assumed that I was on drugs because I shouldn't have had that reaction. He ran all sorts of drug panels on me and they of course all came back negative. They then had to give me Narcan twice to bring me back, as I was out for much longer than I should have been. I'm much better now, but that was an absolute horrible experience. I don't remember all of it, but I do remember my sister who was there with me was in tears from how I was treated. She is a medical professional herself and could not believe what was happening in her own hospital. The doctor who thought I was on drugs no longer works there. I have kind of the opposite story. I was at my friend's kid's 1-year birthday party. They had one of those kid mazes with the slides you go down, and there was some padding and a soft fence at the bottom. Well, when they say these are for kids, adults should listen. I went down the slide and landed hard on my ass. Broke my coccyx. Not like shattered, but either hairline fracture or just very bruised. The next day the pain was really unbearable. I go to the ER to get checked out, and the doctor was asking me all these weirdly invasive questions. If I have a history of opiate abuse, is the pain really that bad? People often fake injuries to get pain meds. I was like, here's a video my friend's mom recorded. When I landed, I literally shouted, "OS, I think I broke my tailbone." He told me there's not much they do for broken tailbones, and they usually just heal on their own. He went to check it to see, and he pushed his finger up on it, and I jumped and screamed so loud. I think by then he figured I really wasn't joking. Prescribed me 800mg Motrin. Now I didn't go to the ER for pain meds, opiates, but to figure out if I really did break my tailbone. After he told me they usually heal on their own, I was ready to leave and just sit on a donut for a few weeks. It did take about 2 weeks for sharpshooting pain to finally go away if I moved the wrong way sitting, and about a full month for me to be back to normal. I went to emergency once with intense chest pain. The young, new doctor I saw first listened to my chest and immediately concluded I had pericarditis, but the supervising doctor decided I was faking it for drugs for some reason. The next morning I woke up to a psychologist in my room asking all sorts of random mess when an orderly interrupted because the ultrasound guy was in and wanted to see me first thing, I think after talking to the first doctor I saw. Turns out I had pericarditis and myocarditis, and the dude wheeled me out himself and told them order an ambulance to take me to a hospital with a cardiac clinic. My sister is a pediatric audiologist and this is my favorite story of hers. Apparently, sometime in elementary school, usually the early grades, a ton of kids like to fake hearing loss. Like not just "oh, I can't hear the teacher." Full on, want to get hearing aids, etc. Anyway, she explained to me that, based on the way she plays the tones, you can usually tell if someone is faking. Especially when they just pretend they can't hear anything. But it's not 100%, obviously, because hearing loss patterns can be really weird. However, she's caught a number of kids simply by saying, "Okay, so I'm going to play a random number of tones and they'll go in both ears. I want you to say yes if you hear it and no if you don't." One time I was in hospital with decompression sickness and neurological damage and I couldn't piss. I told a nurse I needed a catheter, which she did right away, and I filled 3-liter bags straight off. Anyway, she commented that if a man actually says he needs a long tube pushed up the hole in his penis, then you can be sure he needs it done. I'm in the middle of being treated like I'm faking, and it's really frustrating. I had a tool slip at work and hit me in the eye and forehead. Knocked me out for a second, and I lost sight in my eye. An hour later I started getting my sight back, but it hasn't fully come back. It's been months now. Two things I got diagnosed with were ocular migraines and vitreous detachment and a concussion. But none of those things explain why my vision is still blurry in my right eye, except the VD, which causes floaters. But my issue is blurry vision, like I have Vaseline in my eye. But doctors keep telling me I'm fine, that I need to go back to work. One doctor told me to think about the economy and that I was lucky to have a job right now, so I quit my job. I still want to see out of my right eye, but none of the doctors are taking me seriously. Not a doctor but a therapist. For some reason adolescents like faking did, formerly multiple personality disorder. It's a pretty rare and debated diagnosis in our field. I've seen people fake it by mimicking how it's portrayed in movies and on TV. Red flags are them telling you, "I have multiple personality disorder," and, of course, not meeting the actual diagnostic criteria. Some people feel like the common diagnoses aren't big or special enough to accurately represent their struggles, so they cosplay something worse. Whatever you're working through is a big deal to us. If you feel like you have to fake or exaggerate your symptoms for your therapist, consider finding a different therapist. Nurse here. I had a teenager overdose on Zoloft and start having strange seizure-like episodes. What made them particularly strange is that they all followed a predictable pattern of onset. First, he would lower the bed. Next, he would turn the TV volume down. And finally, he would check to see if I was nearby. There was pretty severe thrashing about without any abnormalities in breathing, heart rate, pupils, and he was still able to communicate with me throughout the entire episode. Unsurprisingly, EEG also failed to show any abnormalities. I'm not a physician but a paramedic. Honestly, I don't really care if you're faking, as long as it's halfway believable. I'm still going to treat it as the worst case scenario. Faking a seizure? You'll get a full set of vitals, a blood sugar and a shot of Benzos. There's lots of different types of seizures. If you call 911 because you're in extreme pain and want an ambulance ride, I'll put the good drugs in your vein hole. I'd rather give 100 drug seekers a 100 mcg of fentanyl than withhold it for the one person that really needs it. Can I tell if someone is faking? Yeah, most times, but it goes both ways. If you go too hard, I might assume you have a legit life-threatening injury and sedate, paralyze and intubate you. Or start IVs in your jugular or shin bone. Fake it if you want, but traction may vary. Not a doctor, but I once had a nurse tell me something that stuck with me ever since. I had a gallbladder attack when I was younger, and lem tell you, that's some of the worst pain I've ever felt. I was doubled over, vomiting bile, and unable to move. My mom took me to the ER at 1 AM in the middle of a snowstorm. As the nurse was doing my initial evaluation, she asked me the standard on a scale of 1 to 10 pain question. I thought for a couple seconds and told her 7 or 8. It hurts really bad. She nodded knowingly and told me got it. It hurts really bad. Most people who tell me 10 are lying. No one ever feels a 10. In hindsight, I'm not sure that's the best practice for a nurse. Still, after seeing drug-seeking patients myself, I understand her frustration. They ended up giving me morphine, which brought that number down quite a bit. Not a doc, but figured this is a good place for the time I was accused of faking a broken arm. I was somewhere between 4 to 7. It's a blur, so I don't exactly remember when. I had fallen off of a bed and into a nightstand at just the right angle to really mess my arm up. I was screaming and cried out every time I tried to put pressure on it, lift it, etc. My parents take me to a hospital and get me x-rayed, and the doc asks me how much it hurts. Well, of course, the rest of the night I was subjected to the most intense pain child me had ever had, and currently, I wasn't putting pressure on it, so at that exact moment on a pain scale, I had rated it a 2. The actual injury was a 10, and testing it was definitely high on the scale. Because of my low pain rating, the doctor told my parents I was faking, and then proceeded to bill us an obscene amount. We get a call 3 days later, mind you, I was sent home, no painkillers, cast, nothing, saying that someone happened to peek at my x-ray and noticed that I had a pretty large fracture on my elbow. Said I had to come in and get a cast and more x-rays. I'm still pissed at that doctor to this day because he made child me feel like a liar to my parents, made me feel like I was being a crybaby, and then made me have an untreated fracture in my arm for 3 days.